So today's target for a reproductive endocrinologist and the lab personnel is to have a high pregnancy, a singleton pregnancy, and a term delivery. And this is not an easy task. Gone are the days when we were transferring 3, 4, 5 embryos and ending up with 1 or 2, but thanks to the basic research and also patient's commitment, as a matter of fact. And that led to set the targets a little bit strict, higher, and that's how we have to operate under. So these all targets, they start their initiation. Basically, it happens in the laboratory, and in the lab, we heavily rely on microscopes, and we would not have been able to achieve what we are achieving unless Lewin Hook would have not invented the first microscope. So this is a replica of the first microscope, and he was the one who saw the sperm for the very first time, as a matter of fact. So fast forward to today's embryology laboratory. As you can see from this picture, there's a lot going on. So there's a lot going on. You can say it is basically an equivalent of reproductive tract in a building. We give a lot of emphasis to the air quality within the laboratory. So the air quality rules are very strict, and that's what is the industry standard these days. We really care about not only the particles, but also the volatile organic compounds, which are known to have a detrimental impact on embryo development. And of course, the embryologists and which work behind the scenes, so that is very crucial. And my colleagues are sitting here, so if I may have them stand up so they can be recognized for their good efforts, please. Susan? So these are the folks who work behind the scene, and they should be given credit. And Dr. Bulla, I think he is quite generous in doing so. Thank you. In the lab, we have a very sophisticated kind of equipment, the incubators where everything is kind of grown and cultured and stuff like that. But also some of the tools which are used in micromanipulations when we do intracytoplasmic sperm injections or when we do embryo biopsy. All right, so Dr. Nakajima showed you this picture. So because of these tools and advances in instrumentation, we are able to do intracytoplasmic sperm injection and also embryo biopsies. I'll come back to embryo biopsies towards the later part of my talk.